Dr. Christina Conolly, and welcome again to our MCPS video series, Waymaking. Our goal is to help families make their way through many of the emotional challenges that we are faced with today. I have with me today Dr. Rossen, school psychologist, parent, and director of professional development and standards for the National Association of School Psychologists. Thank you for joining us today.
Thank you for having me here. It's a real pleasure.
Oh, very excited. So my first question for you today is, what do we need to know about stress and trauma?
Well, it's a great question. I think first we need to recognize that not all stress is created equal. And a lot of times people think about stress in kind of three different buckets. We have what's called positive stress. And positive stress are things that we can handle, right? This might be stress over the first day of a new job or stress about giving a presentation in front of your class. These are things that can actually be important and promotive as a part of our development. Second category is what we call tolerable stress. This is more long-lasting but generally time-limited, and it occurs in a context of supports. For example, loss of a loved one or living with a caregiver that's temporarily ill. This is tolerable stress. It's more significant than that positive stress we talked about, but usually people can recover. Then the last category is what we call toxic stress. A lot of times this refers to things like ongoing neglect or abuse or ongoing chronic stress that occurs in the lack of any kind of peer emotional support or adult support. And a lot of times this is what might lead to trauma. Now, the question was, what do we need to know about stress and trauma? And trauma is an extremely significant response to stress. And trauma has kind of these three pieces as far as the definition goes. One, it's either an event or an experience. So it's not just a single event. Sometimes it's this kind of ongoing chronic stress. And so in the current context right now, this chronic stressor of being in an unpredictable environment of unknowing duration, even though it's kind of a singular event, it's ongoing, and so it's the experience of it all. So again, it's not just a single event. Second, it's something that an individual interprets or perceives as threatening or harmful to their well-being. And this is really critical because two kids may experience the same thing and have very different outcomes based on a range of things, including how they appraise the situation. So again, it's how people interpret and perceive their environment, not just whether an adult says, well, this is objectively stressful, and so we expect you to be traumatized. Then lastly, it has a functional impairment. So usually you see things like an interference with their daily life or their ability to function, right? Maybe their appetite changes or their sleep habits change or their relationships are affected by it. But I think most importantly, when it comes to trauma, one thing we all need to remember is that it refers to this subjective response to a set of conditions or experiences that one has, rather than the experience itself. So it's not our jobs as adults to tell children and youth what is traumatic to them. It's our job to respond to it.
Right. And thank you for that. And thank you for explaining, the different types of trauma. And I know we talk about this with our staff. We have an online webinar that goes into and talks about several of these things. But for our families who, they've been having a lot of conversations around traumatic experiences during this time and different impacts of both chronic traumas, acute traumas that may occur to families. So thank you for explaining that a little bit more so our families can understand some of the differences and understand that talking about trauma is broad and talking about some of the specific things that are there. And so then next I want to get into, so we've been hearing a lot about conversations around trauma-informed practices or trauma-informed teaching in schools. So can you go into that in terms of like, why is that topic so important?
Sure. So trauma-informed practices, to get into what it looks like at the school-wide level, obviously requires a lot more time. So my answer will be obviously more brief and more broad. But trauma-informed practices generally describe practices that acknowledge the prevalence and potential impact of toxic stress and trauma on a student's life, and uses that to improve our interactions and interventions with students and families and just how we interact with each other. So it's not really a program, it's a framework within which we operate, within which drives our interactions, which drives like the hypotheses we have and the assumptions we have around people when we're talking about students and any concerns you might have. Now, they're best achieved when the entire staff, and including families as well, have a shared understanding that some of the challenges we have in school are a direct reflection of the environment students live in, as well as their own appraisal of those contexts, rather than always acts of purposeful disobedience. So a lot of times, it's easy as an adult to think that kids are willfully disobedient or they're purposefully trying to make our lives more difficult, rather than saying, well, this is an adaptive and maybe even predictable response to a set of conditions in their lives. A lot of times these are conditions that we don't know about. And that's also why it's really important, because disclosure rates for students disclosing their stress or sources of trauma to adults in their lives is often low, especially if they don't have strong relationships. And so being able to have a broad approach where everyone is interacting with others, recognize that it's potential that some of the responses and behaviors we're seeing are a direct result of stress in their lives. So, the other thing too is trauma and stress can come from multiple sources, right? It can come from family mental illness, abuse and neglect in the home, witnessing violence in the community, discrimination, systematic racism. There's a range of things, both within the context and their personal lives, that can have a severe impact on functioning. So, with the prevalence and significant impact of stress in students' lives, that those trauma-informed practices on a broad universal level are more critical than ever.
Right. And as we get into, and we're talking about families and talking about staff, and when we're talking about, especially, because teachers may be wondering, so how do I know whether a student has been impacted by trauma? And we know that looking at some of the data from there's a study done by the Child Mind Institute that looked at, potentially like half of our students have experienced an adverse childhood event or adverse childhood traumatic event in their lives. And so what are some of the symptoms that show that a student or even a staff member or a family member is potentially in need of help?
Yeah, well, this is a tough question. I mean, first, I've seen a lot of those studies that talk about the prevalence of adverse childhood experiences, right? 50%, and that's been replicated. But it's important to remember too that only a minority of students experiencing ACEs develop full-blown clinical trauma symptoms. So a lot of times, the way they appraise those and the amount of support they have available makes the range of outcomes from those broader. So we don't want to assume that just because there is an adversity in a student's life that they're going to have full-blown trauma, but it doesn't mean we shouldn't be responding to that level of stress. So thinking first just about what happens to a student in a moment, or anybody, not just student, right? Adults too, in a moment of acute stress, right? Our bodies undergo a lot of physiological changes. For example, blood flow moves away from our brain, from the part of our brain that helps us like think and plan and use working memory. Blood goes to our large muscle groups and away from our small muscle groups. So, our heart rate increases, our immune system gets activated, lots of different things are happening. And so what this means is in an acute stress situation, we become like fast, strong, and dumb, right? As some might say. What happens though is when that stress reaction gets triggered multiple times, it gets triggered more easily in the future, meaning that there will be times eventually where to an outside observer, someone may be responding extremely irrationally to non-threatening situations. But when that stress response gets triggered over and over again, it's easier to ignite that. But the broader question about what symptoms do we need to look at? This is somewhat of a challenge. The symptoms are far-ranging and vary depending on a range of individual and environmental factors. SAMHSA, which is a government agency, has put out a list of symptoms for stress and trauma. And it was like 2-3 pages long in very small font and lots of different bullets on a range of categories of cognition, neurological impact, and behavior, and social and emotional. So it can look like a lot of things. It can mirror disabilities like ADHD and learning disabilities and emotional disabilities. So it's really hard to pinpoint what those symptoms are going to be. And this is partly why a trauma-informed approach relies on this universal framework with how we interact with everybody, whether it's our own children or the staff with each other, how families interact with staff, how staff interact with families, with the hypothesis that trauma and stress may, in some way, be contributing to a student's challenges in ways that they cannot articulate. But, other things to think about too, especially as a parent, is, are there significant changes in behavior that we notice? And a lot of times that can be an important thing to pay attention to. But again, it's possible you won't see any changes in behavior, or if there's chronic stress, again, there won't be a change, but they've been under stress for years without us knowing it. So I don't want to say there's a single list of symptoms to pay attention to.
Right. And so, because when we work with staff and with families, many times you may have a kid who is exhibiting symptoms, like you said before, around, like maybe they're inattentive or they're not following directions, or you may think that they're being disrespectful or non-compliant and then all of a sudden we start getting referrals as school psychologists for, like special education, or they need a
Yes.
504 plan, or they need, all these specialized support. And then all of a sudden I'm like, well, you need to diagnose them as having ADHD. And it's like, no, maybe they don't have ADHD. Maybe they might have like PTSD or post-traumatic stress disorder, or some sort of adjustment disorder, or something else showing that these are children who have experienced a traumatic event and they are in need of help. And they are in need of support, and not just a label or something else showing that, they're having some sort of significant issue, or, what can we do to provide these supports for all students within the classroom? How can, talking about teachers who can kind of like restructure their classroom in order to being look at, like, hey, what can we do for all kids? And it's not just, there's, something wrong with this kid, and so what are some ways that families and staff can potentially support those who are impacted?
Yeah, there's a number of ways that we can all work with students, whether they are exhibiting problems or not, or whether we know a trauma history exists or not. And I will say, before I even get into some of those ideas, because I know there are a lot of parents in here. Evidence shows that parents are not accurate judges of their own child's stress. And I'm a parent myself. This is a hard pill to swallow, but I've seen this in the research time and time again. Like, parents consistently tend to underestimate how stressed their children are. And it's quite possible that we will never know, whether we're a parent or an educator, the degree of stress our children and youth experience. And if there are any students watching this, you may be thinking, yeah, like, there are things that I'm never going to talk to my parents about, or anyone on staff. I'm talking to my friends about it only, perhaps. And that's fairly common. So with this in mind, along with a range of potential symptoms, our best bet is to apply some good practices all the time for everyone. So some simple strategies, and these are very broad, but things like empowering students and not disempowering them. And so empowerment a lot of times comes in the form of giving choices and giving options and giving a sense of control, which is more important now than ever, right? I mean, a lot of students, myself included, feel a loss of control over our lives or parts of our lives. And so are there ways that we can establish control, whether it's, something simple for a young student, like, here are the things we need to build into our daily schedule, but I will let you choose where in the schedule that falls, or the different ways you can achieve this, right? If it's reading time, you can either read to me, you can read to someone else, you could do a Zoom call and read to someone else. You can read from a Kindle book or a regular book. I don't really care. The choice is yours. So providing some sense of empowerment. Second one is this idea of unconditional positive regard, this kind of no strings attached relationship contract that we have, where even despite the fact that we may not approve of certain behaviors or things people do, we always approve of them and want them to be a part of our lives. So if we're a staff, a student is not following all the etiquette for our Zoom meetings, that doesn't mean that we simply say, well, we don't want you here anymore, right? We want to work with them and make them feel like we always want you here. You are a part of this community, you're part of this classroom. There are rules in place, but we got to figure out a way to make that happen. We always want to check our assumptions. As adults, it's easy to make assumptions. I make this mistake all the time myself. We make assumptions about others, about the reason for their behavior, and this is a common thing to do. And so it's okay to make assumptions. That's natural and that's human. And so try to think about some of the assumptions you're making and ask questions and observe. So, you know, I can say with one of my daughters, I assumed when all this started back in March and April that she was okay. And I asked her once or twice passively, you know, how are you doing with all this? And then one night I found her crying in her bedroom, and she just said, "I'm so lonely." And I had just assumed she was okay because she never actually said something to me, and eventually she couldn't hold it in any longer. We want to maintain high expectations for everybody, but those expectations shift in focus, right? So maybe our expectations move away from academic excellence and rigor, and instead they're going to, you know, safety behaviors and relationship building and learning to navigate a new system and patience and flexibility and all these other things, caring for others and checking in on others and maintaining relationships when we don't get to see each other every day. We want to listen more and talk less, especially as adults. And this is hard to do because we're used to this kind of reciprocal back and forth. One thing as a psychologist, you know, one thing we learn right away is, you know, sometimes it's not our job to give advice or tell about the time the same thing happened to us, because it's not about us, it's about them. And sometimes just listen and reflect on their experiences. It's not about you. A lot of times if kids want to know what you think or the time that happened to you, they'll ask. So those are just a few ways and simple strategies that can really relieve stress. These are broadly recognized trauma-informed principles.
Right. And so, and thank you so much. You know, and I really do appreciate your example that you gave for your daughter, you know, in terms of some of the symptoms that we may see as students are going through an experience, and staff members too. And you know, because and it's hard, you may have your child or a family member all of a sudden, like you said, you know, break out crying. You may see fits of anger that may come out, and you be like, oh my goodness, like this, you know, this small thing happened and all of a sudden it blows up into this big thing.
Yes.
And you may see that with students who are on the Zoom calls. You may, and I've experienced that even with my own daughter, who all of a sudden now she can't make up her mind in terms of like, am I going to work on this piece of homework? Am I going to work on that? Am I going to eat this for lunch? Am I going to eat this for dinner? Like, I don't know. There's too many choices. I can't figure this out. And she wasn't like that before the pandemic, but these are some of the things that I'm seeing her experience now, just due to the trauma of the loss of friends, the loss of, you know, not being able to interact and go outside as much as I used to, having to wear the mask. Like, you know what? Forget this. I don't want to wear a mask. Why are you making me wear this mask? And you're like, oh my God, like this is something small, but to them, this becomes something so big because of, you know, just going through this chronic stress that's happening. And adults experience this as well. And you see this with family members or others. So, and you know, we just want people to kind of take this kind of like moment. And in our county, like we talk about with staff, you know, kind of when we talk about these trauma informed practices, you know, taking the mindfulness moments, you know, And what are some leadership opportunities? I like when you talked about being able to choose, different options for kids, and being able, because that ability to choose can help to cope. And so with some of the things you were talking about, and I wanted to get into, as we get into, many of our guests who come on to Waymaking, do you have suggestions or feedback for families to help them, again, to stay resilient during this time?
Yeah, I mean, first of all, I just want to say I agree with everything you said. Dr. Conolly, you know as much about this topic as I do, so appreciate all your insight as well. First, I think, we have to sort of recalibrate our balance of structure and flexibility. So one example that I've heard a lot is like, what about screen time, right? And first, we know not all screen time is created equal. Screen time is now a necessity for us to stay engaged and maintain our relationships. So our previous rules around screen time need to be adjusted. But screen time is one of the more readily accessible ways right now for students to regulate themselves and to have time to recharge. And that's particularly true for introverts. Personally, I think it's possible for some that being on a camera for hours may be more exhausting for an introvert than being in a classroom, because their face is always like forward facing. It's always like visible versus like being in a classroom and you're part of a crowd, right? So be a little, allow yourself some flexibility and balance in some of the structures you had in place. And structure is good, but flexibility is good as well. I think setting boundaries is something that people talk about a lot, and it's hard to do. One thing I think would be particularly valuable, is always valuable, is structural boundaries rather than personal boundaries. And I say that in the sense of, if there is a way in your life with the other people you're interacting with to have an agreed upon set of boundaries, so you're not personally responsible for upholding them. So for example, one is like, if you have a team of people that that you email with a lot, you might say, as a group, can we agree that no one's going to be reading or responding to emails over the weekend? Because it's easier for us to have a structural agreement rather than me personally making that decision and being stressed about the fact that I might be missing some important information. Another one is kind of remembering this mantra, which has helped me in a lot of ways in my own personal life, especially as a parent, saying it affects me, but it's not about me. A lot of times the things that happen to us that might make us angry as a parent or a staff member, a lot of times it feels like it's being directed at us, but it's not. It's affecting you, and that's normal. But to remember, this is not about me right now. Even if someone is telling me they hate me or to F myself, a lot of times it's still not about me. I just happen to be the adult in the room, or the person that's confronting or questioning them. We want to continually focus on strategies to maintain relationships. I'm still not sure what that looks like virtually. I don't really have all the answers for that. What I do know is that loneliness is extremely detrimental to our mental health. And I read a recent study just yesterday that the duration of loneliness is more significant on outcomes than the intensity of it. And so this is really long time to be alone and socially isolated. I think avoid the perception of busyness. This idea that it's cool to be super busy. I've always not liked that, the idea, oh, I did this and that, and I don't sleep because I'm so busy. I'm now at the point in my life where I'm like, you know what? I don't think it's cool that you can't manage your time and you don't know how to say no. I think it's cool when you can tell me that you've stayed in your pajamas for 5 days and just binge something on Netflix because you're making time for yourself. That's cool. Avoid the perception of busyness, and then just unburden yourself of unnecessary tasks. I think it's easy for us to be home and be like, well, now that I'm home, it's my time to do this project, to clean the house more, to do more laundry, to whatever. Just forget it. Say, maybe in September I'll revisit this idea, but unburden yourself of that rather than saying maybe tomorrow, maybe tomorrow. Put it off another month. It's cool. It's not going anywhere. Know yourself, and just relax and be easy on yourself. Those are my tips.
No, and I'm sitting here, I'm listening to you, and I'm just shaking my head in agreement. Because I mean, how many families are just like, "Oh my God, I'm feeling so stressed because I can't get this done." You're like, you know what? Take that time for you. It's
Yeah.
all right. You know, my daughter's like yells at me like, "Mommy, it's 6 o'clock. Come upstairs. You gotta eat dinner. Get off the
Yeah.
computer." You know, and how many folks are just like, "Oh my God, I need permission to take time for myself because
Yeah.
of the stress, because the chronic stress is just not good." And this is one thing as and kids are in school, you're like, we all need to have those boundaries. We need to take that time, whether you're an essential employee and you're going to work every day and you're experiencing or working with families who maybe have been impacted by COVID, or your family's been impacted by COVID personally, um, or whether you're at home teleworking. It's like finding those boundaries are so important. My daughter and I now have been binging Hulu and watching the Superstore. Like we never watched that before, but we're like, this is hilarious. And we're just
Yeah.
taking that time right now because we
Absolutely.
need it. Oh my goodness. Like it's just so important. So,
For sure.
I just really want to thank you for taking the time with us today and sharing with us this information. I know many of our families and students will truly appreciate the insights that you've provided. And so we want to thank our viewers for joining us for Waymaking. To send us additional questions and topics to discuss on the show, please visit the link on your screen. And also, please go to our YouTube playlist to find additional shows in our series. We talked about mindfulness. I know one of them is our mindfulness moments. And also, please join us next time on MCPS Waymaking.